My name is Mark Swierczewski. I got into aesthetics about maybe 4 years ago. I'm a practicing dentist for the last 33 years, and it never seemed complete to me. I always use the example that, I do a beautiful case of veneers, but pardon the expression, the rest of the patient's face would be jacked. I never wanted anybody to walk out and say, hey, I love your teeth. I wanted them to say, hey, I love your smile. So that's how it all started. And I'm not going to go into a full soliloquy about Sinclair, but I'm going to tell you that when you're looking for equipment, there's so many different laser companies out there, but there's only one that's going to treat you like your family, and you're with them right now. So just keep that in mind with everything going on. They have so many great products. They have so much post-care support. The portal, you can get everything you want off the portal. So it's just all-inclusive. So my youngest is with us today, and he really hates when I do dad jokes. So what's the sense of having children if you can't embarrass them a little bit? So who here knows about Star Trek? Okay. What is the similarity between a piece of toilet paper and the Starship Enterprise? Both circle Uranus and search for Klingons. Okay, so that's my dad joke. All right. Christian, did I embarrass you enough? Okay, so one of the things I want to talk about with any of the V series is I personally think that it's a dental machine that you can use for aesthetics because there's so many things you can do with the V20. And what I'm going to be speaking about today is TMD. So we all know as dentists what TMD is: non-dental origin in the orofacial region and related zones. So most of the time we're going to see it in the masseter, in the temporalis, sometimes in the frontalis. So it's going to be joint or muscular pain with or without opening or closing your jaw. Very limited movement. Interincisal measurement is very small. Cracking or popping, so crepitus in the TMJ can cause headaches, other things. Atalgia, ear fullness, tinnitus, anything that's sharing the border with the TMJ, which would be the tensor tympani and the tensor palatini. So all innervated by the trigeminal nerve, so all of them interconnected when we're talking about TMJ. So TMD diagnosis, you're going to base it on patient's history. You're also going to base it on physical exam findings. Nighttime bruxism, jaw soreness, morning headaches, use of mouth orthodontics, or history of trauma. So this is for the men in the room. One of the reasons why women clench their teeth is because y'all are mansplaining to everybody, okay? Now, there's a new term for mansplaining. It's called correctile dysfunction. But guess what? There isn't a blue pill for it. So, just calm down with the mansplaining. Women aren't going to be getting the TMJ like they used to. So other things can do it: personal habits, gum chewing, eating very hard foods, anything's going to put stress on the joint. Depression or anxiety, anything, again, that can get you going into bruxism. Anything that could affect the articular disc. And other things can add into it: rheumatoid arthritis, osteoarthritis, obviously trauma. So we're going to diagnose it a lot of times. One of the things I do is I'll put my pinkies in the patient's ear, have them open and close, because I'm going to be able to feel the joint. I'm going to be able to hear any crepitus. We definitely want to get a panoramic x-ray. We want to get a CT if we can. We want to get an MRI if we can to really diagnose everything the way that we want to. So what's nice, again, talking about the portal, is they have all the paperwork that you need on the portal that you can download. Again, we're not reinventing the wheel. Everything's there for you. Everything's turnkey that you're going to be able to do it. So it's just going to be all different medical history questions. What's their primary complaint? If it's the TMJ, is it headaches? Is it soreness with the muscles in the morning? History of trauma, history of clicking and popping, all those things we want to go through. History of pain from clenching. And let's face it, personally, to me, after COVID, we've all been clenching. It's just been crazy because mental health care is not where it needs to be at this point. There's not enough of them to go around. And we see it manifested in the practice. I've never seen so many class 5 lesions that are popping out because people are clenching and grinding. So this all goes together with it. Okay, so radiofrequency, again, this is our prime modality that we're using to treat TMD. So heat's penetrating a few centimeters. It's going to get the cells to speed up a little bit, and the temperature rises. It's going to help everything, just like putting icy hot or something like that on your neck if it's sore, which mine always is. The heat's going to help it. So what we're trying to get out of the radiofrequency treatments is obviously pain relief. Now, this is not to say that this is going to cure the TMJ. You still have to back it up possibly with masseter injections with Botox, with some kind of a bite appliance that's going to open the patient up, not necessarily a hard, soft appliance, because that's closing vertical dimension, so people could actually clench more because of that. So really do your research what type of appliance you want the patient to have, because this is to treat acute and chronic pain, but it's definitely to give patients that relief immediately just from doing this treatment. So again, it's gonna decrease the muscle spasm. It's gonna increase blood flow to the area. Anytime we increase blood flow to the area, it's a good thing because we're gonna start activating the wound healing cascade. So it's gonna bring all the good stuff to the area to help with swelling, increased venous supply, all of that. And then it accelerates the inflammatory process and mobilizes contracted fibrous tissue. Heat's reassuring. The reassurance is an analgesic. And it's not just a psychological effect, it is neurologically based. All right, so the vacuum massage. So you're going to use the V-form with the small head on it, basically on the areas that are a little more fleshy. So when you're doing in the masseter, when you're doing along the jawline down into here. You're going to switch over to the RF when you're doing more bony regions, which would be the temporalis or be the frontalis. So it's going to affect the muscle tone, cause general relaxation. It's going to increase blood flow again to the areas, and it's going to prevent venous stasis. Very important. Provides a washout of metabolites. Okay, it's just like when you work out, your muscles are going to build up lactic acid. Well, this treatment is going to help actually flush out that lactic acid to make sure that the muscle's firing properly. Reduces edema, helps to compensate for the impaired venous return. And it stimulates the cutaneous receptors, potentially causing local lateral inhibition of pain feedback to the spinal cord. Same reason why we're shaking the patient's lip when we're given anesthesia, all based on the gate control theory. So it's going to increase lymphatic drainage, get rid of the metabolic waste, and this is what I'm talking about too. It's going to flush out your lactic acid from your muscles. Okay, so core and multi-core technology is the basis for the V series. So it's basically the VST, that's for smaller areas, that's for the more bony areas, has contact cooling, it's bipolar radiofrequency. All of you remember the old electrosurges where it was monopolar that you had to ground the patient. So what's great about this is all bipolar. It's going from one to the next, so you don't have to ground the patient. V-form is going to help out because it's a broader area, but you don't want to go too big with the attachment that you're using because you still have to have all the probes contacting on the skin. So the small one is definitely the way to go with this treatment. All right, so there's 3 distinct radiofrequency channels, mode 1, mode 2, mode 3, and mode 4 is pretty much the multi-channel that it's dealing with all the layers. All right, so with the frequency, it's going to get to a depth of the 0.8. It's going to get to a depth of 7.2 millimeters. 1.7 gets to 5.1. 2.45 gets to 3.9. So you can treat a range of things just because this has different depths that it can go to. Same with the V-form, all about depth of penetration. What's nice about the vacuum system too is it's bringing everything up closer to the surface. It's going to get heated a lot quicker. I love the V-form because when you're heating the skin up, you don't even have to look anywhere on the machine. Basically, your temperature is right there. So it's telling you when you're getting to your peak temperature, and that's a great thing to have, that you're not constantly moving back and forth looking at the machine. So very well researched as far as the relief that you're getting with TMD. White papers were done on it, which pretty much all of Sinclair's products have a lot of research, a lot of white papers on it, showing that, okay, if you're jumping into this, you're not going to make a mistake because they have the research to back it up. So they're looking at pain reduction level and also interincisal opening, okay? So depending on 1, 2, or 3 treatments, you can see it all worked to help break the spasm that the TMD is causing. All right, so it's 6-minute treatments, pain improvement of 100% of cases, pain relief and aid in interincisal opening, both important things with it. It's comfortable. It's like a lot of the things, pre-May, when Heather was talking about it earlier. There's something about when you're doing whether it's the collagen plus, whether it's the ultrasound, whether it's the CO2 microdermabrasion, there's something calming and relaxing about the vibration, the heat, all that stuff. So all that's going to kind of tie into it. Again, we're trying to get out of that spasm that the muscles are in. And like anything, we obviously want to bring in revenue. This is a good gateway as a dentist to talk to people about other cosmetic things, because maybe they're not even thinking about it at the time, but they're trusting your judgment with their dental care. They're also going to trust you if you're helping with the TMJ, and that's going to make it segue into a much easier conversation about some of your other aesthetic treatments. All right, so the V-form protocol, again, with the small applicator. Thin layer of glycerin, not too much. You just want the glycerin to help glide the unit along. Too much, it's going to get clogged up. Too little, you could be shocking the patient. Not a good thing. So if their skin temperature is below 30, you're going to preheat the area. Mode 4, again, that's getting all the layers. That's going to get you up to temperature the quickest with everything. You want to get to that 39-degree point. So the settings are mode 1. The time is 6 minutes. The vacuum only is tolerated because it may be in such bad spasm that it's just really irritating them. And then you're going to affect your levels with the radio frequency, how much you're going to give. You don't want this to be painful. You want it to be a more enjoyable experience, so you don't want to just blast them all of a sudden. So just kind of beware of what you're treating, but it really does a great job to help break that spasm. And again, the thermometer is right in the handpiece, so you can constantly monitor the skin as you're going. Obviously, you don't want to get it above 42 degrees because then there could be some issues. So you're constantly going to be monitoring to make sure that you're getting enough heat but not too much. All right, ST protocol again, temporalis. Some people do it on the frontalis. The bony spots, because to get the V-form on an area like your forehead where the skin is very thin, where it's tight down to bone, it's very hard to get contact. But with the ST, because it's a smaller footprint, much easier. So again, this is going to be ultrasound gel like pretty much all of the radio frequencies. Mode 1, you're gonna give the RF. 6 passes over each zone, so you're going to do zones of 10 centimeters by 10 centimeters at the largest. And there are hygienic tips for these, especially if you're using this to do lip plumping or other things. Some of the vaginal rejuvenation too, they have disposable hygienic tips if you want to do that. All right, so the schedule of treatments for acute pain, 1 to 3 treatments. That should take care of it. Chronic pain, you want to do 6 treatments. Acute pain is going to be, you're going to do it and then wait 4 days and do that till you get to relief, but usually no more than 3 treatments. Chronic pain, it's 4 days, 4 days, 7 days, 10 days, 14 days. And again, 6 minutes per zone because that's giving you your maximum efficacy as far as the temperature, the radio frequency, all of that. And maintenance as required. But again, we're not selling this as a panacea that this is going to take care of all their TMJ. This is to take care of the immediate symptoms, and then you're going to have to follow up whether it's a bite appliance, whether it's Botox into the masseter, any of those things. But again, this is going to get the people out of pain, and they're going to love you for that. All the people that tell you they hate coming to the dentist, I can guarantee you they're not going to tell you this after you do this treatment on it because they're going to feel relief, and it's not going to be something that's painful while you're getting it done. All right, so that's all I have. If you have any questions, I'm going to be here both days. I have pretty much every Sinclair device, so if you have questions about any of them, please feel free to talk to me. I'm kind of a BSer, so I do love to talk, so anybody that has questions, just come on over to me. But thank you again.